Okay, just imagine this for a second. You're tasked with improving the health of over a billion people. I mean, where would you even begin? That is the absolutely massive challenge India took on with its national health mission. So today, we're going to unpack this incredible story, a story of huge ambition, some really clever innovation, and, as we'll see, some serious impact.
Let's start with just one number, 167. Before the National Health Mission got underway, this was India's maternal mortality rate. That means 167 mothers were lost for every 100,000 live births. It's a really stark figure, and it's the number that basically screamed for urgent, radical change. So that leads us right to the heart of our question today. How do you even start to fix a problem on that scale? How does an entire nation build a system to heal itself and, protect its most vulnerable people? That's the journey we're about to go on. Well, the answer was to think big, really big. The idea was to create a single national mission that could bring together all the efforts, all the resources, and create one unified vision for a healthier India. And that was the beginning of the National Health Mission, or the NHM. Now, a mission this huge didn't just appear overnight. It grew, it evolved. It actually kicked off way back in 2005 as the National Rural Health Mission, focusing, as the name suggests, on the countryside. Then, a huge step in 2013, it merged with the urban mission to become the comprehensive NHM that we're talking about today. And more recently, in 2018, the Ayushman Bharat scheme, that's the health insurance part, was folded in, adding another really powerful layer to the whole thing. So what was this whole mission trying to achieve? Well, it all boiled down to 4 core goals. First, and this was the big one, slash those maternal and infant death rates. Second, make healthcare accessible and affordable for everyone, universal access. Third, work towards gender and demographic balance. And fourth, strengthen the entire health system from the ground up. Now, for all of you studying to be doctors, these objectives are literally the foundation of the public health system you're about to walk into. Okay, awesome. So we've got the why. Now let's dive into the how. What are the actual nuts and bolts of the NHM? How does this grand blueprint actually translate into action on the ground? You can think of the NHM as being built on 5 key pillars. It's about making the health system stronger, improving how services are delivered, making sure we have enough skilled healthcare workers, and, crucially, getting the community involved. It's a multi-pronged attack on the problem. And a big part of that service delivery is a concept we're about to get into called RMNCH+A. You're going to hear this acronym a lot, so let's break it down. RMCNCH+A. It stands for Reproductive, Maternal, Neonatal, Child, and Adolescent Health. Now, what's really brilliant here is the idea of a continuum of care. See, the mission realized you can't just treat someone at a single moment in time. You have to connect the dots and ensure their health across all the critical stages of life. So what does that actually look like? It means everything from giving iron supplements to a teenage girl, to making sure she has a skilled professional with her when she gives birth, to immunizing her newborn baby, and then monitoring that child's growth. It's about connecting every single point in that journey. So who are the people actually delivering this care at the community level? It's this incredible trio of frontline health workers, the real boots on the ground. First, you have the ASHA, or Accredited Social Health Activist. She's the community's health guide, literally knocking on doors, connecting families to clinics. Then there's the A&M, the auxiliary nurse midwife, who's often the very first clinical professional a mother interacts with. And finally, the Anganwadi worker, who focuses on nutrition and early education to make sure the next generation gets the best possible start. As future doctors, remember this. These 3 are going to be your most important allies out in the community. And just to give you a sense of the sheer scale we're talking about here, the mission mobilized 1.2 million, that's 12 lakh, ASHA workers. This is one of the largest community health worker programs anywhere in the world. This incredible human network is the absolute backbone of the entire mission. Okay, so that's the plan, that's the architecture. But after more than a decade of all this hard work, you have to ask the big question. Did it actually work? Let's take a look at the report card. And this chart says it all. Remember that number we started with, 167? Well, the National Health Mission drove it down to 97. That is a massive reduction. We're talking about tens of thousands of mothers' lives saved every single year. It's a huge victory. And the success story just keeps going when you look at the infant mortality rate. The mission pushed the IMR down from 44 to 32 deaths per 1,000 live births. Again, these aren't just statistics on a chart. These are real, tangible, life-saving results from a massive national effort. So how did they do it? Well, one of the key strategies was to encourage more births to happen in healthcare facilities. And look at this. Institutional deliveries shot up to 89%. Getting mothers into clinics and hospitals for a safe delivery is directly tied to those falling mortality rates we just saw. So the bottom line is, the strategy worked.
But the impact was way bigger than just those mortality numbers. The mission strengthened over 1.2 lakh health facilities. It made essential drugs and diagnostics available for free. It pushed full immunization coverage up to 76%, and it expanded modern services like telemedicine. It was about making the whole system stronger, top to bottom.
Now, while the successes are absolutely undeniable, the journey is far from over. I mean, a mission this ambitious is always going to face challenges. So what's next for the NHM? Let's take an honest look. This really gives us that balanced picture. The progress, it's crystal clear, but the challenges are just as real. Things like infrastructure gaps in rural areas. That's not just about buildings, that's about whether a clinic has reliable electricity to keep vaccines cold. Shortages of healthcare workers mean one doctor might be trying to serve a population meant for 3, and variations in quality mean the care you get can depend more on your zip code than your actual condition. And then there's the constant question of money. How do you keep funding this huge effort for the long haul? All of this work, all of this effort to overcome these challenges, it's all driving towards one ultimate goal: universal health coverage by 2030. What does that mean? It means ensuring every single person in India can get the quality healthcare they need whenever they need it without facing financial ruin. That is the final destination. And so, we're going to end with a question for you. The National Health Mission has created the blueprint. It's laid the foundation. But a system is only as strong as the people working inside it. So as the next generation of doctors, how will you step in to help bridge that final gap between this ambitious policy on paper and the real everyday patient in front of you? Because the next chapter of this incredible mission, well, that's yours to write.